This video is on the importance of augmented reality in learning of complex subjects like anatomy. Now, there is no other way by which you could understand the different facets and views of a bone, like in an augmented reality video. See, what happens is, if you take a bone like, let's say, femur, there are some parts like greater trochanter, which are visible from the anterior view and the posterior view, but it looks completely different from these two views. So only when you get a dual view, you'll be able to correctly identify greater trochanter. The trochanteric fossa is visible only from the posterior view. Similarly, the linea aspera, which is a line on the shaft of femur, is visible only on the posterior view. The medial condyle is visible only on posterior view. The patellar trochanter and patellar trochlea are visible only on the anterior view. The intercondyloid fossa and the lateral condyles are visible only on the posterior view. So why I'm telling you is, in an augmented reality video, one should be able to turn around the bone gently, slightly, and get the different views: anterior, posterior, ventral, dorsal, from above, from below. So you get the full perspective. It's not as if we cannot draw pictures showing all these views, but then the bone will look completely different in each of these views. But when you have an augmented reality femur in hand, you can turn it around and see clearly each of these parts and how they look different from different views. And sometimes as you turn, you get a view which is neither anterior nor posterior. You could call it anterior-posterior view or posterior-anterior view, which is a unique privilege only the students using augmented reality can get. So what is suggested is using augmented reality for learning anatomy. Please note, even for medical students, the ultimate learning experience for anatomy would be nothing but augmented reality. Because in the anatomy lab, you are given bones, of course, but then identifying different parts on a bone is a task indeed. Whereas in augmented reality, you get the view of the bone from all angles with clear markings, so that you get a much better understanding of the structure and the shape of the bone, which is even better than reality. So that's why it's called augmented reality. So I would suggest this for school students, college students, even professional college students. Thank you very much.